So this is the follow-up video to my pediatric sensory neural hearing loss case study. Starting off with Kat's question, was there a reason you initially presented WRS at a conversational level? So this is something that we regularly do for most hearing tests, unless we have individuals with a clear, significant diminished hearing sensitivity. Performing WRS at average conversational level actually serves as a really great tool for patients. It provides them with clear results about how much they're actually struggling when we isolate the ears, when we take away context, and we take away visual cues. This, in combination with results at elevated intensities, as well as our speech and noise testing, it truly provides our patient with beneficial information about their speech intelligibility so that they can make informed decisions about their treatments. And even for us, the providers, it gives us some insight into whether there are any struggles occurring and whether the patient has passed that threshold from passive listener to active listener. Next up, Taryn's question. This is a question about children with newly identified hearing loss. Is your site required to report this finding to the state? Do you forward the results to the child's PCP, or is this done by the child's parent? This is a great question, and unfortunately, I only have half an answer. At this moment, only one provider sees children for hearing tests at our private practice, and it's really only been a handful of times in the last few months. The parents who bring their children in to see us have already seen another audiologist, and they're really only coming to us for a second opinion or really because they trust our audiologist. We have not had to report to the state as far as I'm concerned, but we typically forward results to the child's PCP unless the parent specifically says otherwise. Typically, we usually communicate extensively with other interprofessionals working with that child and their parent regardless. All right, Vince's question. Was the mother interested in following up with any of the recommendations? Were they going to get a hearing aid? If they're interested, what hearing aid would you recommend for this patient? Now, once we compare the results from that appointment with results from the previous appointment, the mother was satisfied with the validity and reliability of the results. Coming into this appointment, I believe she was also kind of coming to terms with her child's hearing loss. And once we listed the recommendations, amplification specifically, she was completely on board, as well as any other things that we needed to do, any adjustments or anything in the classroom for the child. The mother hadn't done any research regarding hearing aids, so we recommended PhoneAct devices, and she was completely on board, like I said. Ultimately, our goal was to ensure that that the child would have optimum listening in the classroom. So our audiologist has been in constant contact with the mother. I have not, but the other audiologist has. And finally, Carlos's question. Did they ever find out what the cause was for the sudden changes in hearing, since it seemed that their hearing appeared to be normal from their earlier developmental stages? Unfortunately, I also don't have an answer for this question. I'm sorry. We did recommend genetic testing. However, I have not heard anything about whether it actually happened or what the results were. I personally have not been in contact with the mother, but the other audiologist has. Thank you.